Hi, I'm going to talk to you today about tongs. I'm going to leave this one up for a little while. And one of the things we do use a lot in Chinese medicine is tongue diagnosis. So what we'd be doing when we ask a patient to pop out their tongue and show me, we would be going blah, as you can see with this one. But what we would actually be looking for is to see that it is a nice pink colour with an even layer of nodules, that it's thin with a light, thin white coat, very light, and that the tongue colour is visible throughout the coat and that the lustre is there but not glossy, and that it's not too wet. Now, what's that telling me in Chinese medicine? That you're very fit and healthy. However, what can it tell me if you're not fit and healthy? This tongue is getting on my nerves, so it's coming off. That's better. So when we're looking at tongue diagnosis, we're looking at the qi, the blood, the yin, the yang, and your fluids, as well as other meridians and internal organs. I'll show you a picture. So as you can see, different areas of the tongue show us different meridians. So the very base of the tongue shows us the kidney meridian, the bladder meridian, the intestines. The middle shows us your digestive aspects, your stomach, your spleen, your energy. The side shows us the sinews with the gallbladder, the liver, the nerve system. And we often find people with sciatica do bite the sides of their tongues. It's a little flabby. The very tip of the tongue is the heart meridian, which we often see is red in diagnostic conditions such as neurodivergence. You often see a very red tongue in neurodivergent conditions, but you'll also see a red tip where there is also mental health disorders. And lungs, so if you have any problems in the lung area, you are likely to have problems with asthma, breathing and things like that. So we're looking to see, is the tongue too red? Is it purple? Is it blue? Is it black? If it's black, we've got bigger problems. We want to see if there's any coat. Is it yellow, indicating too much heat and a bit of phlegm in there? Is it wet and damp, telling me there's too much cold in there? Or if it's glossy and damp, it's telling me there's too much damp in there. And it could even show me some phlegm. And this tells me where to put the pins so I know how to treat with acupuncture. Or I can recommend some lifestyle and dietary advice. And it's one of the ways that we can really work out what's going on internally, and even if the tongue is straight. Because if it's leaning to one side, we can see there's too much wind, there may be epilepsy, there may be some Parkinson's going on, there may even be a stroke or a TIA issue or history. This has been Thoughts with Points. Check out those tongs, guys. Don't brush off your coat. Use it as a diagnostic tool to change your diet and lifestyle. This has been Thoughts with Points. Take care.